Okay, hey YouTube. It is 90 days until my SRS surgery, so I know I've taken the last couple days off. Been pretty busy with work, and maybe I will be able to go and backfill that content sometime here eventually. But in terms of surgery planning, I have been able to get quite a few things kind of knocked out over the this past week, and so it actually started on Monday with me going to see a PhD level therapist for my second letter of recommendation for SRS, or basically kind of approval or whatever, basically saying that I'm not batshit crazy, that I totally know what's going on, that I meet all the requirements, kind of those CYA things. And then I was also able to schedule a follow-up appointment with my doctor, who treats me here in Dallas, and was able to get the EKG, physical, and blood work all scheduled. And so that can all be one appointment beginning of October. Get a lot of that paperwork that Dr. McGinn needs. The only one they couldn't do was the chest x-ray, so I have to set that up separately. And so between the two letters and all those pre-reqs, I'm now basically covered in terms of what Dr. McGinn wants for her purposes. The only thing left for me to do is hair removal around the genital area. I can't get them to call me back or even answer my calls, so I'm going to start looking beyond just E3000, which, I don't know, it sounds uncommon where I know a lot of people go to E3000, but for whatever reason, they're just not picking up. And it's like, I'm ready to basically give you at least $1,000 of business, and you can't be bothered to call me back. Like, not good. Not a good strategy there, folks. But yeah, that is basically where I am in terms of surgery. I know that I now need to take those two letters, get them sent off to McGinn, and get them sent off to insurance, because that's the big hurdle to kind of overcome here. So if I'm at 90 days, basically means I'm at 3 months. However, Dr. McGinn expects to be paid 6 weeks in advance, and I think you kind of have to pay for maybe other things as well. And so I know that the insurance timeline, never the quickest to respond to claims, and so that is why I'm hoping to get that kind of second letter complete, revised, whatever, sometime either hopefully tomorrow or at the beginning of next week, so that I can get those sent off and dealt with as well. And I guess the nice thing is that I do still have my case manager, the company provides, to help me maybe navigate some of those steps. But once insurance is done and once general SRS is, or genital hair removal is done, I will be all set to go. And the nice thing about having to do this work kind of in advance is that those sort of 30 days before SRS, I will get to relax as much as you can, knowing that kind of those 2 weeks before surgery, no more estrogen, no more alcohol, kind of lots of restrictions as you get closer and closer to the day. So that is where I am, and